At the turn of the last century, while seeing patients in Vienna and writing The Interpretation of Dreams, the young Freud escaped the city to take walks in Wienerwald, the Vienna woods. As a gay literature student, I was not a big fan of Freud until I read some of his early theories. That all humans were bisexual, that hysterical women were the victims of the sexual double standards of Viennese society, the Freud who, on his sojourns in the woods, worked out his theories about the unconscious world hidden in dreams. In 2019, I moved my practice from Manhattan to a green space I created in Brooklyn named The Vault. Situated above the East River, I considered how urban spaces impact mental wellness and emotional recovery, how certain imagined environments allowed my patients to explore dreams or confront fears, and how changes in the geography of the city were making it harder to fit therapy sessions into a work week. Out of this need to reimagine new ways to carve out therapeutic spaces, I began to meet colleagues once a week in virtual reality to analyze dreams. And so we created the virtual therapy collective, The Young Freuds. Then in 2020, therapeutic work the world over became virtual. In the following video, I will tell you how my work with patients has evolved over 3 different virtual reality platforms, why virtual reality has advantages over conventional telehealth video sessions for a number of therapeutic interventions, and I will end with what I see as the future of VR therapies. I'm Dr. Andrew Anson. I'm a board-certified psychiatrist, a psychoanalyst, and an attending at Yale New Haven Health's Smilow Cancer Center. I'll begin by telling you about VTime XR. Have you ever woken with the fragment of a dream? A tiny piece of perhaps a larger tapestry that's still there in your mind even as the rest is slipping away? It may not even make for a story. Maybe nothing happens in the dream at all. It's sort of like a previous apartment, but also kind of like a place you used to visit as a kid. But there is a powerful feeling about that place, and there's the possibility that if you could just spend a little more time there, you could find the words to describe it. What if you could have a whole session there? VTime XR is a private hangout social app on Oculus that begins in Freud's London office and lets my patients and me choose from a dozen virtual environments to have a session. Users appear as avatars that they design. I find this app ideal for patients already comfortable being on the couch, and for patients who struggle to forget their work obligations for the duration of a 45-minute session. It has practical appeal for those of us who haven't been able to leave our houses or apartments because of the pandemic or illness. I took my 92-year-old grandfather on a trip to Paris for the first time. There are theories that we communicate unconsciously by being 2 bodies in a room. As silly as avatars seem at first, I think VTime captures this. I consistently have the experience with patients and analytic colleagues that I was together with them someplace else, even after I take the headset off and find myself back in my office. I once had a patient with nightmares of being underwater decide to do whole sessions in the deep blue, exploring what comes up. When it comes to exposure therapy, SciAS has its own platform of dozens of exposure therapy environments, each with its own graduated exposure progression. Afraid of MRI machines, heights, flying, elevators, riding a subway car after a pandemic? SciAS can actually quantify biometric data through skin conductance electrodes and patient-reported subjective units of distress in real time during the session to monitor progress or pause the exposure and do a breathing exercise. One of the first studies validating the use of this kind of platform was looking at women with breast cancer using mindfulness exercises to modulate cancer pain. SciAS works both on a Samsung Gear headset and on the Oculus Go, and also has the advantage of the clinician not needing to be physically in the same room as the patient with the headset. We now offer the SciAS platform to all of our cancer patients at Yale New Haven's Smilow Cancer Center. Finally, I'd like to say a few words about Grove. Grove is a confidential group therapy app on the Oculus platform that can host groups of up to 5 users. It has been utilized during the pandemic for our AA meetings and other kinds of user-led support groups. I meet the young Freuds on Grove for our weekly clinical peer supervision. As VR headsets become affordable enough for patients and clinics to invest in one, and as millennials and Zoomers become fluent in this technology, I suspect that meeting your psychiatrist virtually will one day become the norm. And I suspect that the public health concerns of 2020 will only accelerate the alternatives to conventional telehealth technology. Imagine letting a trans individual try out transitioning virtually as they edit their avatar every week, or letting a patient design his or her own consultation room. Or imagine being able to listen to your own voice narrate the dream you recorded upon waking for you and your therapist to listen to in session. What if you could go back to that safe place you found in therapy before drifting off to sleep? This is the future of virtual reality therapies. I appreciate your joining me for this overview and for pushing like on the button below. Please reach out to the Young Freuds or Smilow Cancer Center if you think VR therapy is right for you.